Hey there, Empowered Tribe. It's Angela T. Moore. You are getting ready to experience the 8th episode of Empowered, a health and wellness podcast where I share my personal journey of health and healing, tips for mental and physical health, interviews with health and wellness experts and those bold enough and vulnerable enough to share their own journeys to empower you to succeed in yours. We know that life can be rewarding. It can also be challenging. It has its ups and downs, highs and lows. I learned that with a strong mind and a fit body, you are better able to grow through and grow from whatever life throws your way. My goal is to share journeys of health and wellness, as well as tips and information from extraordinary people all around the world to help you live an empowered life. As a program officer at the Ralph C. Wilson Jr. Foundation, my guest, Misha Stallworth West, is a driving force in enhancing the quality of life in Western New York and Southeast Michigan. Misha's decades-long commitment to advocacy is reflected in her role supporting the Foundation's caregivers and young adults and working families' portfolios. With extensive experience in civic engagement, social justice advocacy, and youth development, she brings a wealth of knowledge to her role. Misha's approach centers around systems-level change, community-driven solutions, and person-centered design. In this episode, Misha talks about caregivers and caregiving, and how the Ralph C. Wilson Foundation, in collaboration with the Michigan Endowment Fund, has committed $3.7 million to a family caregiver respite called Exhale. Misha and I discuss the many types of caregivers and caregiving, and the importance of providing caregivers with rest and resources so that they can effectively and compassionately care for their loved ones. Misha also shares her own personal experiences with caregiving. I hope you enjoy the episode. Misha, I learned in my research prior to today's show that Ralph C. Wilson Jr. believed to make effective change, efforts should make an impact from the start, yet carry long into the future. To do both, he earmarked a portion of his estate and his eventual sale, its beloved Buffalo Bills, to fund his namesake foundation. Why is caregiving a focus area for the Ralph C. Wilson Jr. Foundation?
So towards the end of Mr. Wilson's life, caregivers had a huge impact on him personally, whether it was the direct care workers that were providing support, or his wife, his family, the family caregivers that were in his life, making sure that he was getting the things that he needed. And so our trustees were actually the ones that decided on the focus areas of the foundation, but it was reflecting back on that experience and on their conversations with Mr. Wilson while he was alive that said, we know caregivers are really important. We understand the impact that these folks have on people's lives, and we need to make sure that they're really well supported.
Okay, now there are more than 40 million family members, spouses, daughters, sons, grandchildren, and friends in the United States caring for older adults, a number that will grow dramatically in the coming years. Can you speak about the state of family caregiving in Michigan today, and how do you see it looking differently, if at all, in the future?
Michigan is a rapidly aging population. I mean, we are hearing about it all the time in the news, whether it's our elected officials talking about what's going on with the economy, what's going on with housing, what's going on with the workforce, right? We know it's a rapidly aging community. And as people age, we tend to need help. So then that ties us into our community and the way our community supports us. And I think one of the things that's really interesting about when we think about caregivers is we get this idea in our mind, I think, that is the spouse or the daughter, right? But it's also the neighbor who adds your groceries to theirs when they go to the store. In some communities, it's the really close friend because they've been alienated from their blood family, right? And so it's that really close friend that goes with them to doctor's appointments, right? And they're trying to figure out, how do I make sure that person's included on my emergency contact information? So, when we talk about how the community is changing and what it's going to look like in Michigan, we're also talking about how these networks of support and what a family caregiver network really looks like changes in Michigan.
Mm-hmm. Well, because what you're saying is basically what we think about when in terms of caregiving. is that the caregiver can be many different things.
Yeah. Absolutely. Absolutely. It's, it is as immersive as living together, right? And it is as, let's say, segmented as running errands or just worrying about someone. And this is a person that I put it in my calendar to call every day at the same time because I know they need that touch point. That is another way that you could be a caregiver for someone.
Now, I have learned that people are often passionate about the work that they do for an organization when they are connected in some personal way to the goals of that organization. What does caregiving mean to you personally?
Yeah, so up until 2020, I was really fortunate to have all of my grandparents in my life. Around 2013, the caregiving needs started to show up one at a time. And so from that period until each one passed away, by 2020, I have been involved in caregiving with my family. I've supported a grandmother who lived in senior housing and needed help, but eventually transitioned into a nursing home. And that means that, it's between my mom and I to make sure she gets her pantyhose, her toothpaste, her, just the everyday essentials that we don't necessarily think about all the time. Being in a nursing home doesn't mean that you have those things. You still need support. You still need care from the family, in addition to working with the care workers, right? So there are those things. I've had grandparents who were aging in their homes, but their illnesses had them in hospitals perpetually, in the doctor's office perpetually. And I, was a part of the care team in those appointments at the home with their in-home aides and things like that. So it means a lot to me because, one, that connection kept me very close with my grandparents, but also all of that work sometimes made it really hard for us to continue to have the more fun and light relationship we had before. And so, I think that's one of the reasons why we focus so much on respite, on giving caregivers a break, so that you can continue to have those loving relationships.
Well, one of the things that I definitely am hearing from what you said just now and then also earlier in today's interview is that caregiving and the caregiver can be very different. Yeah. The caregiver, as you say, can be many different people, can be the neighbor, can be a friend, can be a family member, but also the different forms of caregiving. It can be, as you say, assisting someone within their home, attending a doctor's appointment with someone, making an intentional phone call. I don't think that many people think about caregiving or the caregiver in all those different ways. So thank you so much for going into the detail of that, because I don't think, the reason why I think it's so significant is because I don't think that caregivers even recognize that they are caregivers.
Right, yeah. Right. People do not identify with that term. It just is not the thing that comes to mind. We use it because it helps us to provide programs if we're all using the same language. But we have to take time to peel it back so people can really see themselves in the things that they're doing.
Yeah, and the reason why that's so important is because if you are a caregiver and you haven't defined yourself as a caregiver, and let's say you're caring for the individuals within your own home and maybe in a relative's home, and maybe you're assisting a friend, what you may not realize is that you are using your time and your energy to care for a lot of different people, which means you would really have to be very mindful to be taking really good care of yourself so that you're able to do that, because you're being responsible for multiple people. So that's why I think it's so significant.
That's exactly it. And what we see is that folks who are caregivers are more likely to need care in the future because of the mental, emotional strain, because maybe they had to leave the workforce and therefore don't have the resources that they had before, right? If they're doing a lot of lifting and transferring, the physical care component of it, right? You have back injuries and so forth. And so that's the other reason that while all the services that support older adults who need care are very important, but zooming in on the caregiver is essential as well.
Now, I understand that the foundation, in collaboration with the Michigan Endowment Fund, is committing $3.7 million to a new family caregiver respite initiative called Exhale. I love the name, launching in January here in Michigan. Can you tell us more about that?
Yeah, so we actually launched Exhale in 2019, starting in Western New York. Our second cohort included 3 projects that were in Southeast Michigan. So that was the first time that we brought it to Southeast Michigan. And now we're really excited because we're expanding. Those 3 projects were just in Washtenaw County. We're now expanding across 7 counties of Southeast Michigan. And so it's going to provide the opportunity to really expand the network of respite for family caregivers. And just in a moment, when we say respite, we just mean a break, a mental break, an emotional break, a physical break, the break that the caregiver says that they need.
Gotcha. Yeah. Thank you for defining that. Yeah. It's interesting because in preparation for today's interview, I was trying to get an understanding of what respite really is, and the definitions vary so much, and I see why now.
Yeah. And I think one of the things that we love about this project is that the proposal process is all about creativity and innovation. And so we really take a step back from a specific definition of respite to give organizations the opportunity to identify what they're hearing from caregivers in terms of what a break would look like, and to figure out how they might provide that break.
Okay, gotcha. Now, one of the things that I have in my notes that we haven't talked about is I understand that there are project teams and different organizations that have to partner with others to receive grant funding. Can you talk a little bit more about that?
Yep. So what we do is we kick off a series of workshops, and that is the proposal development process.
Okay.
When you go through that process, you're with other organizations and you're all talking together about what you're seeing, what you're hearing from caregivers, and thinking through how you might provide that respite. What that allows folks to do is to really matchmake and say, well, I can provide, let's say, care for the older adult. Can you provide the service, the program for the caregiver, right? Okay. Or I can do chore services, and these folks do occupational therapy, and these folks do friendly visitor. How can we all come together on one project that supports the need of a caregiver? So that whole proposal development process is what leads to those collaborative projects.
Okay, understood. Now, one of the things that I have in my notes is that there is a workshop series that's going to be coming up. Can you talk about that workshop series?
Yep. So that's the workshop series launches on the 25th.
Okay.
Organizations do have to register ahead of time by the 22nd. That's at exhaleforcaregivers.org. And so that workshop series is that we call it creative problem solving. And we really want to put that emphasis on the creativity. We want folks to know that they can opt in and really just figure out what makes sense, as opposed to thinking that they're excluded because they don't provide a certain type of service.
I see.
And so that whole process, that proposal process, is that workshop series.
Okay, understood. Yeah. Now, of all the things that family caregivers need, why focus on respite? Why is respite so important?
Because that's what they told us.
Yeah. Oh, interesting. Okay.
Yeah. And
expand.
In our work, we really try to center the voices of caregivers. And so across surveys and data hours, other national surveys, what bubbles up is that caregivers need a break. There are many programs that provide a break, and then they say, and now you can do an educational class about caregiving. Caregivers are like, I can't even take that information in if I don't get a deep breath, which is what led to the name Exhale. It's like, let's take that deep breath, and then we can recalibrate for what's going on in our lives.
Yeah, that makes so much sense. Something, I don't know if you know, so I'm a therapist. And one of the things that I try to teach my clients is the importance of creating time and space to rest so that they can make critical decisions, so that they can take action in their lives. Because if you're so tired, if you're so fatigued, if you're so stressed out, you can't even think logically, rationally.
And you can't think logically and rationally, and you can't do the things you feel responsible for at the level that maybe meets your standards, right? Sense, yeah. So then you also pile on guilt and and it just becomes this, what is it, auto-cataclysmic, this like perpetual cycle.
Yeah, most definitely. Well, as we talked about earlier, if you are caring for a number of people, or if you are caring for one person in many different ways, you are probably pushing yourself to your limits quite often.
Yeah. And I love that you raised caring for multiple people, because oftentimes we talk about this, we do think about it as a person or maybe a family caring for one person. But typically, once you know one person that's older, you know a lot of people who are older. So you may be providing care in different ways to different people. So I really love that you pointed that out.
Yeah, no, thank you. Well, it's interesting because I've worked with a number of individuals of different ages, and I have to say almost every client, especially those clients I work with for a long time, they do run into that where they are caring for older people. And sometimes it is a parent, sometimes it's a much older sibling. It's many different situations. And I think what we have to understand is that when you're caring for someone, you are giving.
Yes.
Yeah, and your tank gets a little empty, and you need to be able to have time and space to stop and kind of fill your tank back up so that you have something to give back out.
Absolutely. Absolutely.
Now, why did you decide to bring Excel to Michigan? Why was Excel brought to Michigan?
I think we've talked a little bit about the statistics. We know it's an aging community. Our foundation serves Western New York and Southeast Michigan, and we're very intentional about making sure the work we do really is in both communities. So honestly, the short answer is that the need is here.
Okay. Now, you mentioned New York. How different is the programming in New York versus Michigan? Do you see a considerable difference?
I don't know that I would say I see a considerable difference. All of these organizations talk to the caregivers they serve and design something that is custom for them.
Okay.
So in that sense, we know when we talk about what a break looks like, we know there are caregivers who need to run errands. We know there are caregivers who need an emotional or a mental break. We know, the types of breaks are pretty consistent across communities. I think with this expansion, we'll see even more in terms of, well, what is it looking like in Washtenaw County versus Wayne versus Oakland versus St. Clair? I think that's where it'll get really interesting.
Yeah, I could definitely see that from a sociological perspective too. Yeah. Now, what kinds of Excel projects have you seen that you feel are particularly innovative or beneficial to family caregivers?
Yeah, so I'll lift up a couple of projects and one model that is not necessarily, actually it is happening, but so I'll lift up a couple of projects. So one is our Ypsilanti Meals on Wheels project.
Okay.
Ypsilanti Meals on Wheels is the primary grantee, but they're working with Seniors Helping Seniors, the Catholic Services of Washtenaw County, as well as Disability Made Easy. And their evaluation is supported by an organization called the Southeast Michigan Senior Regional Collaborative. So I'm lifting that up to just really demonstrate what we mean when we say a collaborative project. These are all the folks that are involved. And while Ypsilanti Meals on Wheels can identify caregivers, they have healthcare workers, they have occupational therapists. These other organizations are plugging in for the chore services, for the in-home respite where someone is staying with the person that the caregiver cares for, with their loved one, so that they can do something, right? Across these organizations, this multitude of services is able to be provided. And so I really kind of wanted to share that one because I think it demonstrates what a collaborative can look like. You know, maybe you're an organization that doesn't have a physical space, but you provide a particular service. Partner up with an organization that has the space, right? So that is a really exciting one. In Western New York, there's another really innovative one from an organization, Healthy Community Alliance, that's all about providing technology to caregivers in their homes. And so that one really looks at that mental and emotional break. Things like a Ring camera that you use inside your home, maybe. And then you can step outside into the garden and you're not as anxious, right? Or an Apple Watch and you're getting a reminder to get up and walk around and count your steps. And you're getting more physical movement instead of kind of being glued to a chair where maybe that's where you just worry about things, or maybe that's where you go through your documents. Get up, walk around. So that one's really exciting because they talk to the caregivers about their specific needs. So, you know, I care for my mom. She isn't mobile, but she's comfortable in her space. And I worry about these things. Okay, an iPad where you can play a game or where your mom can play a game while you do something else. You know, so that one's really cool because it's tailored. And it really thinks about a different type of break. It doesn't mean you have to physically separate necessarily.
Yeah, I love that. Yeah. Well, in this technological world that we live in, I think that if technology can be used to the advantage of caregivers, or the person receiving care, like you said, if you can give the person you're caring for the iPad and say, you know, take a look at this while I clean up or while I pick up some items or something like that. It gives you a peace of mind. Yeah, because you know that the person is content and they're okay.
Yeah, and that one's being used in a rural community too. So whereas in places where we literally live a little closer to our neighbors, you might have someone who can pop by and help you with that. Where if you're living further apart, having those tools is really helpful. And the other one I wanted to just point out real quick.
No, you have time.
Okay. As there's a model called a memory cafe.
Memory cafe.
Yes. Okay. And this model is really cool because it's a way that organizations that maybe don't focus on older adults typically can get involved with a project like this. So a memory cafe is really just a space where a caregiver and the person they care for can have an experience together that is not about care or illness.
Okay, very important. Yeah.
Yep. So it could be seeing a movie together. It could be a museum together. It could be a music performance together. Whatever it is that's together. And so what the organization or organizations would take on in a model like that is just making sure the space is suitable for the person who needs care. It's accessible. And the model typically focuses on dementia and Alzheimer's.
Okay.
And so in Saline, we've actually seen this model occur with Imagine Theaters, where the individuals, the staff, were trained on how to support folks with Alzheimer's, how to support the caregivers. They do kind of a low sensory afternoon film. Folks can come and do that. So that's another just really cool model where maybe you're a for-profit business, maybe you're a arts or cultural organization, a library. This opportunity makes sense for you too.
Yeah, I love that because I don't think that people realize how the importance of doing something other than caretaking and care receiving. I think it's really important that we understand. Something I always talk about is the importance of thinking about the whole person. And we tend to define somebody by one characteristic or trait. And then we kind of, we interact with them based on that one characteristic or trait. So if you're sick, we tend to think about the person as just their sickness, their illness, their disease. And I think it's so important to remember that these individuals are people and they have things that they like to laugh, they like to have fun, they like to be able to experience things just like anybody else.
Yeah, and I think the critical part about that is when we think about that caregiving relationship, just about the illness, it sets the caregiver up to start grieving early. They start that grief process almost immediately because they're already thinking about what's lost, what's going to be lost. And so the more they have opportunities to connect with one another around their current relationship and not centered on that illness, the more, joy and, again, that mental and emotional break can occur.
Yeah, that's so important. Yeah, that's so important. Yeah. Now, gosh, our time is flying by so fast, but I want to make sure that I give you the opportunity to talk about things that I think are going to be beneficial to the people that are going to be listening to the podcast. Because nonprofit organizations, businesses, and employers of caregivers that are based in Southeast Michigan are eligible to participate in Excel, and those interested in developing a caregiver respite project will receive free training and creative problem-solving support throughout the grant application process and a series of the virtual and in-person workshops. I think it's really important to emphasize that because we want people to take advantage of that. So can you tell us a bit about the grant application process, where the hopes for Excel in Michigan, and where can listeners learn more about Excel? So I know I threw a lot of questions at you. Specifically, can you tell us a little bit about the grant application process?
Yep, absolutely. So one, everything I'm about to say, you can find at exhaleforcaregivers.org.
Okay, perfect.
Just start there.
Okay.
So starting on January 25th, there will be 5 workshop sessions, and that is the proposal development process.
Okay.
Those workshops will cover things like creative problem solving, cover things like learning about caregivers, but really be a space for the organizations to connect with one another and think about what kind of project they want to propose.
Okay.
Participating in those sessions is mandatory to apply for funding.
Okay.
And organizations that participate will receive a $500 stipend to support their time being there.
Okay.
At the conclusion of that workshop series, the project leader will submit a short version of their proposal for review. And that proposal will cover all the organizations that are participating on the project. They'll get feedback and then refine it and submit the full proposal to receive funding and launch the projects.
Okay, gotcha. So what are your hopes for Excel in Michigan?
My biggest hope is just more respite.
Yeah.
And different kinds of respite. I would be ecstatic if we saw lots of different types of organizations get involved. If businesses got involved to think about how to support their staff who are caregiving, if schools got involved to think about how to support their students who are going to doctor's appointments and helping with medications. I would love to see organizations that are thinking about how queer communities address caregiving for their elders. We just want to see more respite for more caregivers in Southeast Michigan.
Gotcha. And I love that you included a lot of different types of populations. Yeah, because again, we tend to think just kind of like, one-dimensional, and there's so many different types of people, so many wonderful people that want to provide care for their special friends, family members, and those people that they care about.
Yeah, absolutely.
Yeah. So again, where can people learn more about the program and about, everything we talked about today?
exhaleforcaregivers.org. And there you can also find a recording of the webinar session that occurred on December 12th.
Oh, perfect.
There's another webinar, January 8th at 10 a.m., where you can learn more and ask questions to the project team, and you see some of the folks who are thinking about getting involved and perhaps get inspired. And then again, that kickoff is January 25th.
Okay. Now, with the possibility that this podcast is going to air after January 8th, what would you tell somebody that's going to miss that January 8th
Yep.
Yeah.
I would say watch the recorded webinars.
Okay, perfect.
So those recordings are there.
Okay.
The website also has information about all the different projects that currently exist. So I would say just explore the website and really think about it as a way to get inspired.
Okay, perfect. And the website again?
exhaleforcaregivers.org.
Okay, perfect. Well, thank you so much for taking time out of your day to always share your purpose and your passion with those that are going to be listening to the podcast. I really appreciate it.
I appreciate you having us. We're really looking forward to seeing who all, shows up to the workshops.
Yeah, definitely. Well, thanks again. I really appreciate it.
See you.
Thanks for listening to Empower It with Angela T. Moore. Feel free to share this episode with someone you think would enjoy it. New episodes come out weekly. Follow our show on Apple, Spotify, YouTube, or wherever you're listening right now.